Pregnancy is a remarkable experience that is marked by a series of rapid physical and emotional transformations. During this transformative period, your food choices play a pivotal role in your well-being and that of your growing baby. Proper nutrition not only supports a healthy pregnancy, but also aids in the baby's development and your postpartum recovery. Today, we will highlight the essential nutrients, foods to embrace, and those to steer clear of during your pregnancy experience. The importance of a balanced diet. A well-rounded diet during pregnancy is crucial for various reasons. First and foremost, it ensures that both you and your baby receive the necessary nutrients for optimal growth and development. A balanced diet can also help alleviate common pregnancy discomforts, such as nausea, fatigue, and constipation. Furthermore, maintaining a healthy weight through proper nutrition reduces the risk of complications like gestational diabetes and preeclampsia. A guide to healthy eating for mom and baby. Pregnancy is a miraculous journey filled with anticipation and excitement, but it also comes with a set of dietary do's and don'ts that can sometimes feel overwhelming. After all, what you eat during pregnancy doesn't just affect you. It can also impact the health and development of your unborn baby. First, let's debunk a common myth: eating for two. While it's true that you're nourishing both yourself and your baby, you don't need to double your calorie intake. In fact, during the first trimester, you don't need to increase your calories at all. In the second trimester, a modest increase of 350 calories per day is sufficient. And in the third trimester, aim for an additional 450 calories. But it's not just about quantity, it's also about quality. Your body requires specific vitamins, minerals, and nutrients to support a healthy pregnancy. One crucial nutrient is folic acid, also known as vitamin B9. Folic acid plays a vital role in preventing neural tube defects in the baby. Foods rich in folic acid include leafy greens, lentils, beans, and citrus fruits. Whole grains should also be a staple in your pregnancy diet. Opt for complex carbohydrates like brown rice, whole wheat bread, and oatmeal, which provide sustained energy and essential nutrients. Similarly, lean proteins such as chicken breast, fish, nuts, and legumes support fetal growth and development. Speaking of fish, while it's an excellent source of protein and essential omega-3 fatty acids like DHA, it's essential to be mindful of mercury levels. Large predatory fish like sharks, swordfish, and king mackerel can contain high levels of mercury, which can harm the baby's developing nervous system. Also, limit tuna intake to once a week or less. During pregnancy, it's common to experience peculiar cravings and indulge in occasional treats. However, moderation is key, especially when it comes to sugary foods and saturated fats. Opt for healthier alternatives and limit your intake of sweets and processed meats. On the flip side, you should avoid certain foods and beverages altogether during pregnancy. Alcohol, for instance, poses significant risks to fetal development and should be abstained from entirely. Similarly, avoid unpasteurized dairy products, soft cheeses, and undercooked meats to minimize the risk of foodborne illnesses. Caffeine intake should also be monitored, with the recommended daily limit at 200 milligrams. Remember that caffeine is not just found in coffee, but also in tea, soda, and chocolate. Lastly, it's crucial to be cautious with medications during pregnancy. Some drugs, like retinoids and certain seizure medications, can pose serious risks to fetal health. Always consult with your healthcare provider before taking any medication, including over-the-counter remedies. During pregnancy, avocados are considered a top superfood. They are packed with essential nutrients like vitamin E, folic acid, and potassium, and they offer a superabundance of health benefits to both mom and baby. Their creamy texture and versatility make them a delicious addition to any meal. Pregnancy food do's, nutrients to prioritize. During pregnancy, your body requires an increased intake of certain essential nutrients to support the growing fetus and accommodate the physiological changes. Some key nutrients to prioritize include folate, vitamin B9. Folate is crucial for preventing neural tube defects and is essential in the early stages of pregnancy. Fortified cereals, leafy greens, citrus fruits, and beans are excellent sources. Iron. Iron deficiency can lead to anemia, which can increase the risk of preterm birth and low birth weight. Iron-rich options include red meat, poultry, lentils, spinach, and fortified cereals. Calcium. Calcium is vital for developing your baby's bones and teeth, and it supports your musculoskeletal system. Dairy products, leafy greens, and fortified plant-based milk alternatives are excellent calcium sources. Omega-3 fatty acids. These essential fats contribute to the baby's brain and eye development. Fatty fish, like salmon salmon and sardines, as well as walnuts and flax seeds, are excellent sources. Protein. Protein supports the increasing blood supply during pregnancy, and it's crucial for the growth and repair of tissues. Lean meat, poultry, eggs, legumes, and dairy products are excellent protein sources. Nutrient-dense superfoods. In addition to focusing on specific nutrients, incorporating nutrient-dense superfoods into your diet can provide an extensive collection of essential vitamins, minerals, and antioxidants. Some of the pregnancy-friendly superfoods to consider include leafy greens, such as spinach, kale, and Swiss chard. These are rich in folate, iron, calcium, and vitamins A, C, and K. Fatty fish, such as salmon, sardines, and mackerel, are packed with omega-3 fatty acids and protein, and berries like blueberries, raspberries, and strawberries are high in antioxidants, vitamin C, and fiber. Sweet potatoes are rich in beta-carotene, vitamin C, and fiber, while whole grains, such as quinoa, brown rice, and oats provide complex carbohydrates, fiber, and essential nutrients. Also, there are nuts and seeds, such as almonds, walnuts, and chia seeds, which offer protein, healthy fats, and various vitamins and minerals. Hydration. The overlooked essential. Staying hydrated is crucial during pregnancy, as increased blood volume and bodily fluid levels require additional water intake. Aim for at least 8 glasses of water or other fluids daily, adjusting as needed based on your activity level and climate. Proper hydration can alleviate common pregnancy discomforts like constipation and fatigue while supporting the efficient transfer of nutrients to your baby. Pregnancy food. Don'ts. Steering clear of potential risks. While embracing nutrient-rich foods during pregnancy is essential, it's equally important to be aware of potential risks associated with certain foods and foodborne illnesses. Some foods and substances to avoid or consume with caution include raw or undercooked meat, poultry, and seafood. These can harbor harmful bacteria like Salmonella and Listeria, which can cause severe food poisoning. Raw or lightly cooked eggs are potential sources of Salmonella. Processed meats like deli meats, hot dogs, and other processed meats may contain harmful bacteria like Listeria if not heated properly. Also, it is important to thoroughly wash all fruits and vegetables to remove potential contaminants and harmful bacteria. Substances to limit or avoid. Caffeine. While moderate caffeine consumption is generally considered safe during pregnancy, excessive intake can lead to increased heart rate and potential complications. It's best to limit caffeine intake to no more than 200 milligrams per day. Alcohol. There is no safe level of alcohol consumption during pregnancy. As stated earlier, alcohol can disrupt fetal development and lead to serious congenital disabilities. Artificial sweeteners. While the safety of some artificial sweeteners during pregnancy is debated, it's best to consume them in moderation and consult with your healthcare provider. High mercury fish. As mentioned earlier, large predatory fish like sharks, swordfish, and king mackerel can contain high levels of mercury, which can harm the developing fetus. Food safety precautions. In addition to being mindful of specific foods and substances, practicing proper food safety measures during pregnancy is crucial. Here are some important food safety tips to keep in mind. Make sure to cook foods to their recommended internal temperatures to eliminate any harmful bacteria, and avoid cross-contamination by separating raw and cooked foods, using separate cutting boards, and washing your hands and surfaces often. Keep perishable foods refrigerated promptly, throw away any expired or spoiled items, and always heat up leftovers thoroughly before consuming. Listening to your body and seeking professional guidance. Every pregnancy is unique, and some women may experience specific food aversions or cravings. It's essential to listen to your body and respect its signals, but also consult with your healthcare provider if you have concerns or specific dietary needs. Additionally, if you experience severe morning sickness or food aversions that make it challenging to maintain a balanced diet, seek guidance from a registered dietitian or your healthcare provider to ensure you and your baby receive the necessary nutrients. Pregnancy is a time of incredible change and growth. By making informed choices about your diet, you're not just nourishing your body, but also nurturing the tiny blessing within you. Remember, there's no single perfect pregnancy diet. Focus on a balanced approach, prioritize healthy choices, and don't hesitate to seek guidance from your doctor or a registered dietitian. By embracing the do's and avoiding the don'ts of pregnancy food, you can ensure a healthy and delicious journey towards motherhood.